Our next discussion is titled Healthy Housing, Healthy Kids. Please welcome moderator Eunice Hernandez, Director, Green Communities, Enterprise Community Partners.
Thank you, everyone. Hello. How are you? Fully caffeinated, I hope? I'll just give folks a couple of minutes to congregate over while we introduce our panel, and I just encourage our panelists to come on stage. We're starting off with Dr. Elizabeth Baca, who is a pediatrician and senior health advisor with the California Governor's Office of Planning and Research. And then next we have Rebecca Levine Coley, who is a professor with Boston College. And finally we have, and he leaves little need, he doesn't necessarily require much of an introduction, but Jonathan Rose, who's the president of Jonathan Rose Companies, who many of you know, and has been a real pioneer of sustainability in the affordable housing sector. So I'll give folks maybe a couple of minutes to congregate in. I want to make sure folks are fully aware of this particular panel, because I think it does build off of some of the comments that were touched upon in the last panel, which I think really address the quality of housing. And I think this particular panel is going to focus in depth on why housing matters from a quality standpoint. So interestingly enough, we all know that housing plays a role as a strong key determinant of health for many of the children in the communities that we serve across the country. Interestingly enough, many of us know that health is actually driven more by environmental and behavioral factors than genetics and access to health care. This is especially true for where I grew up in the Bronx, where access to health care is not necessarily an issue, but housing quality is, unfortunately. With that said, we as an affordable housing community really have a tremendous opportunity to address health outcomes and to sort of take a line from the last panel, really look at how investments, every dollar we invest in housing can truly have multiple benefits in terms of better health outcomes from a stability standpoint, as well as for health promotion as well. So we're going to talk a little bit about sort of what are the key particular characteristics in the housing environment that can help to really promote and advance better health outcomes. But before I kick it over to our esteemed panel, I wanted to talk a little bit about an anniversary that we as a community within affordable housing is celebrating together. So this month, Enterprise, through our Green Communities program, has actually celebrates a 10-year anniversary of weaving in green and environmental sustainability measures into the preservation and development of affordable housing. And this is in particular truly important because we started off in 2004 when green was really still seen as a luxury, and some can argue that it's still seen as a luxury today. But with the influence of Jonathan Rose, who sat on our board, we were really inspired to think about all the holistic approach to addressing sustainability that looks at the outcomes of these particular measures from a health standpoint. And it's interesting to note that within our Green Communities criteria, the largest section of our criteria is our healthy living environment section, which addresses potential opportunities for smoke-free housing policies, as well as access to fresh and healthy foods. So I just want to sort of plant the seed that sustainability and health are really interconnected, and I think we'll see more of that throughout the discussion this early going into the afternoon here. So with that said, I want to talk a little bit about the Green Communities program, and in particular, the Green Communities criteria as a national standard. This particular session is going to touch upon, as I mentioned earlier, some of the specific building characteristics that can better advance health outcomes. And I think it's equally important to share with folks in this room who share that anniversary with Enterprise. Many of our friends are in the room that helped in the early days in building out the particular program definition in terms of how we define affordable housing. Is this year we're actually going through an update of this criterion that is really looking at elevating health as a priority and an outcome for the built environment, as well as resilience in terms of really ensuring the level of stability when disruptions occur. So I encourage all of you to take part in that collaborative process that kicked off about a month or two ago. And one other piece I wanted to talk about is really, when we think about health in the context of affordable housing, what we really want to ensure that we have a very sort of baseline definition, and there are sort of 4 critical components that we really need to think about when we talk about health in the context of affordable housing. One of which is just on a basic level, and we talk a little bit about it in terms of stability, but it is that platform that provides the level of comfort and safety that many children need to thrive. As was noted in the previous panel, academic achievement is critically important for future and better life outcomes. So ensuring that the comfort is a key component of the housing, as well as ensuring that is at a basic level clean, ensuring that it's properly ventilated and maintained, as well as free of chemicals and pest infiltration. I think this is another area that is sort of becoming my pet sort of mission, which is really ensuring that we're removing toxins as well as pests outside of the home. I think someone who's new to our board, Dr. Megan Sandell, who's in the audience today, is a physician and comes to this from a very sort of practical standpoint, understanding that the home environment can have such an impact on health outcomes for families is critically important. So ensuring that that basic quality is, from a cleanliness standpoint, is critical. And then finally, and I think we're going to touch upon this throughout the day, is the connections to services. I think we addressed education in the previous panel, but connections to nutritional food options, as well as access to healthcare services, which we'll talk a little bit about in this particular panel, is really important as we start to really think about much more of a holistic framework to health beyond just the buildings to the surrounding communities. So with that said, I just want to run through each of the panelists and their presentations. And we're going to start off with Elizabeth Baca, who is really going to talk about, from a state-level approach, the opportunities to really influence systems-based changes on a policy level. And then we'll hear from Rebecca, who will share a lot of the research that she's been involved in and leading, which address sort of why housing quality matters from the standpoint of childhood development. And then finally, we're going to hear about the project that's actually a companion to this particular session, is the profile of the Paseo Verde project, which is a project in Philadelphia that incorporates both an integrative and enhanced approach to enhancing the healthy environments, but also access to a healthcare center on site. So with that, I'll turn it over to Rebecca.
Great. Well, it is great to be here with you today. It's really quite an honor. And I think one of the things that's so exciting, especially having worked in health for quite a while now, is that there's really been this transition and this movement and this broader conversation of what health really means over the last several years. And I think it's exciting to be part of that right now. What I hope to do is provide a little bit of a clinical context as well, since I actually do have a background as a physician, but with a background in policy. And I quickly wanted to get a show of hands. How many of you in the audience provide clinical services? Just raise your hands. Okay, great. And how many of you do planning, like urban planning? A couple more hands. Okay, fantastic. So that's really the context that I want to be able to provide today. So I work in the Governor's Office of Planning and Research, and I see some of my colleagues here today, which is really exciting. But the Governor's Office of Planning and Research was established in the 70s by statute, and it varies throughout administration. In some cases, it's been likened to a think and a do tank, and I think that's really where we're at today. It's really exciting to get to work on this at a state level. The other thing I would say is that, as we think about health, I think one of the biggest things is, what does health really mean? So, when I went into clinical, go ahead and put the first slide. When I went into clinical practice, especially as I looked at all of the different opportunities, I'd done policy beforehand, but I chose pediatrics in large part because it was this great opportunity to do preventive care, right? Children, by and large, tend to be healthier. They're younger, so there's a lot more of opportunity to really think about prevention. And so that was really what called to me on my path of going into medicine, is to help kids achieve their fullest potential. And I've trained in, always really worked specifically with low-income populations. And what was really shocking to me when I entered residency was how many of the kids really were unhealthy. So they were really struggling with diseases that we would tend to think about for adults. I think one of the video this morning was so powerful, and that could have been any of my patients, and the situations that the family was dealing with. When you have $40 left after you've spent all of that money on housing, it's really hard to buy healthy foods. Some of the issues that I would see were asthma. I dealt with a ton of children who struggled with asthma, and I think as we'll get into it a little bit more, that really has a huge implication around what's in the home. So, one of the things I used to teach when I was directing the community pediatric rotation was to ask about all of these environmental factors in the home. And so we would go through screening questions. We could have children seeing the pulmonologist. They would be getting excellent care. We worked with home health nurses that would do visits to try and remediate some of the issues. And we also worked with medical legal partners when landlords weren't actually making those changes. But by and large, what would happen is we could do the best medical management, and if they were still in areas where it was unhealthy, then they would be coming back sick to urgent care visits and or to the hospital. And one of the stories was actually when I was screening one of the families, we would go through the questions like, what kind of cleaners are you using, and what's your air like, do you have mold? And one of the families was, do you have pets? And the answer, the mom was like, no. And then the kid was like, sí, los ratones, like the rats, right? And you're like, no. So I am gonna join you on your charge to make sure that homes are healthy free of pests. The other thing is depression. So, I think we'll get into that a little bit with development, but when we think about kids, another vital sign for children is how they're learning. So how are they doing developmentally? How are they doing in school, which is really important after the last panel. And childhood obesity, I think one of the things, we don't have time to get necessarily into a lot of the numbers today, but probably about a third of the children that I took care of struggled with being overweight or obese. And so we, again, from the clinical setting, we could do all of these interventions. So we could say, we're gonna sit down, we're gonna work on eating less hot Cheetos and getting some more exercise and drinking water, and families were really dedicated. And what would happen is with those clinical tools, they would come back in a period of 2 or 3 months, and we would check in on how they were doing. And many of the families did have success, so I don't want to say that that's not possible, it is. But I think also through the clinical experience, you could see how many barriers they faced. So, at the check-in, it would say, we found a great after-school program, but we can't get there because mom's working 2 jobs. Or the park, we had a shooting recently, and I don't feel safe sending my child to go and exercise there. Or I had a bike and the bike was stolen. So I was doing this work and then my bike was gone. So really you recognize that all of these factors really directly impact health, and a lot of that has to do with where the housing is located and the quality of the housing. And I think that really gets to what does health really mean. So when I used to teach residents, one of the first questions that I would ask them is, how do you define health? And everyone's like, I know what health is, right? We all know what health is. And then I say, well, tell me about it, define it. And I was actually just doing a panel at Berkeley, and I had the students do this. So it was great to hear the variety of answers. So one of the older practitioners who was out there, Tom Lent, who you know, said it's the absence of disease. I said, that's great, let's go to another one. And then someone said, it's mental health. It's having a good place where you can feel safe and having good mental health. I said, that's great. And then one of the ones that was really memorable was its happiness. And I think earlier we were hearing about well-being, but I think that is really what we're starting to think about in the context of health. And one of the things is we often, especially culturally, and I think there's this huge paradigm shift happening right now in health, but we tend to think about health as the individual, right? So if you're making the right decisions, or you're doing the right actions, or you're eating the right food, then you're healthy. And if you're not, then you're not. But I think that the really big part is this all happens within a context, which is what we're talking about today, really focusing on. Also called the determinants of health or well-being. In academic circles, we call them the social determinants of health. And I think it's just really this great recognition, especially from the clinical context, that all of those things really impact health. And it was a large reason why I ended up transitioning to do policy full-time, because I saw all of those barriers as we were talking about earlier. An interesting thing was, while I was teaching the residents, we were actually we were building a website to train the residents about all of these factors, right? And it's a very different way of seeing health, and even residency training programs and medical schools have really started to incorporate this into their curriculum. But one of the things I was doing at the time was I was combing the literature for all of these research studies to look at what's been done, what is the evidence, what's the level of evidence. And it was really fascinating, because so many of them at the end would say, we know these things are having an impact. And the conclusion this conclusionary statement would be, and we need to change the built environment. And I was like, that's great, but then how do we do that? And I think that was a lot of the motivation how I ended up transitioning to the work that I'm doing now. So I'll tell you a little bit about that. So in the Governor's Office of Planning and Research, one of the things that we work on is we have a lot of different policies, a lot of climate change work, drought work. So it's fantastic because I get to work with colleagues from very different backgrounds. I'm the first person to have a health focus to be in the office, and this opportunity came up to update our state general plan guidelines. Really interesting, Secretary Castro was mentioning Vision 2030. And that, when I think about the general plan guidelines, it's an opportunity. In most places it's called the comprehensive plan, but actually it sounds very esoteric, really important for zoning and for where we put resources in a community. And so for our general plan guidelines, they were last updated in 2003. And essentially this becomes an advisory document that all local jurisdictions can look to, so both at the city and the county level, to help decide how they're going to plan their communities. And this goes back to really transportation and housing, and where do you put transportation and housing and parks. So all of these issues that are really important can initially start off with the framework for the general plan guidelines. So what we were able to do is, recognizing that health is a bigger there's a broader context to have this picture of health. We were able to do outreach across the state with planners, with public health departments, with the state agencies, with nonprofits. So we worked with Safe Routes to School all the way to AARP to get their input on healthy communities and how to plan. And really, what's the vision? What would the vision look like? What are the things that are important when we're thinking about the built environment and how that impacts, these planning decisions impact health? Really important, I think some of the themes that have already really come out today from the conference. One was partnership and the importance of doing partnership. We definitely cannot do this work alone. It really takes working across sectors with researchers, with planners, with developers. So that's been a really key piece. The other thing I would say, and that's come out as well, is the opportunity for community engagement. So it was really fascinating hearing the San Antonio experience of having people come together and say, what would we like our community to look like, and what really matters? And so when we did this process to get input to inform the guidelines, we really had 8 key themes, and housing actually was one of those key themes. In addition, we talked about active living in recreation, so things like active design and incorporating active design principles. Health and human services was another one, so thinking about innovative models of bringing human services and making sure that there's transportation. I know some of the developments actually even incorporate clinics on site, which is really meeting people where they're at and with what they need. And then climate and resiliency, I think that's one of the big things that we've been talking about today, as we're talking about what makes a community resilient. A lot of those same principles of being able to talk to your neighbor and how you get around, those are also very similar things to what helps make a community healthy. For housing, it was really interesting because housing, we think a lot about asthma or the rats or the pest infestations, but we don't necessarily link that as a health issue when we're thinking about location, so walkability and safety. But as I mentioned, from the clinical perspective, that definitely comes out. Also exposure to toxic things, jobs, access to jobs for parents, and even childcare has come out as an important issue. Quality is definitely something that we know a lot about. And then I would say the last key piece that came out from talking to everyone across the state with all of our different partners has been affordability and the issue of displacement and social connection and cohesion. So really important keys to think through. The other thing that we're doing is we actually have data indicators that we're going to be suggesting to go along with these policies to help start thinking about tracking some of these at the local level. And we have a lot of examples from partners that have been really fantastic. I could talk about this for the next hour and a half, but I want to make sure and turn it over to the panels. But the last thing I wanted to do is just show a couple of slides. And again, I think it really goes back to this is the opportunity to create a vision in local communities. So when we think about communities, sometimes when we talk about it in the more global sense, it can be hard to visualize. These are images from a colleague and partner at Urban Advantage. And this is, you could see this and you could imagine this in many areas across the US. This is Sacramento County. You can see that it's kids trying to get to school, walking along an open highway as we think about where their housing is and how they get to their school. But when we start to say if we prioritize certain policies, such as having more active design space, oh, it's stuck. Maybe, can you advance the slide from the back? There we go. You could see how that would be able to create actual bike paths. And so it becomes safer. And then you say, well, if we're trying to make this a nicer place, we can actually start to think about adding in some tree canopy. One of the big programs we've had is urban greening, right? And so when you're thinking about walking, that's a place that people actually want to be. It also helps with a lot of our other goals. So I think it's just a really powerful example of how the policy can be put into place to support that, especially things like active transportation. Having served on many grant review committees and being able to reward funds, having those policies in place in the general plan and zoning and by specific areas really helped to get the funds to start to build that vision forward. And when I showed these slides to Jonathan, he said, these are great. Do you have some for community development with retail? So this, again, is an example of what a community could definitely look like. And when you start to think about adding in some bike paths, making it a little bit nicer for walking, you could think about densifying housing back there so that there's housing in these places that are near amenities. And then the last piece is really thinking, again, and it goes back to that economic side of what's there to help anchor in some of the finances into the local community and bringing in retail development. So on that, I will hand it off.
Thank you for that. And one thing I did want to mention before the next presentation is that we're going to have time at the end for questions. So I already have about 3 on my end. So I want to make sure that everyone else is thinking through the questions that they want to pose to the panelists at the end. Thanks.
Thank you. Whoops. All right. So I'm a developmental psychologist. So when I was asked to speak about housing and health, the first thing that came to mind is that I define health very broadly. So when I think of children's healthy development, I think not just of their physical health and the lack of disease. I think of their emotional and behavioral health. I think of their ability to function properly in school, to go to school ready to learn, to achieve high levels of academic success, and become healthy, productive members of society. So looking at the research on housing and children's healthy development in the past couple decades, I think we had a few areas where the research was quite strong, and we were quite certain of some clear causal associations. So for example, there's very strong research that exposure to lead paint leads to cognitive deficits in children, that exposure to cockroaches as well as rats and mice is strongly associated with asthma rates. And there's also research showing that just this broader level of chaos in homes, so a loud level of noise, crowding, instability, is associated with cognitive and behavioral deficits for children. But I think the research base in the past couple decades was also very limited in many areas. So I think there was much less strong evidence on the role of housing costs and housing mobility. I think there was much less information on how housing in neighborhoods were interrelated, and also much less of a focus on adolescence. So a great amount of the research on housing and children's health and well-being really focused on very young children. So the lead paint work, the cockroach work, is mostly on very young children, and we know much less about adolescents. So my colleagues and I, with funding from the MacArthur Foundation, set out to do a whole new program of research trying to address many of these questions. And following a sample of about 2,500 poor and low-income children over multiple years, and very closely looking at their housing context, their neighborhood context, their school success, their family processes, to try to tear apart these multiple issues that are often integrally related and understand which pieces of their housing and community context were really making a difference for healthy child development. And these are some of our primary findings. So first of all, we looked at a variety of characteristics of housing. So looking at the quality of the housing, so whether the housing had lead paint, pests, exposed wiring, but also a lack of things, a lack of heat, a lack of hot water. So when we think of extremely low quality housing, we often think that that's not very common in the United States. And really in comparison to poor and developing countries, extremely poor quality housing without running water, for example, is pretty uncommon. But there are families within, particularly families living in poverty and in rural areas and in densely concentrated poverty urban neighborhoods that are exposed to a variety of housing problems like that, lacking electricity, exposed wiring. And we found that of all of the housing characteristics, so looking at affordability, residential mobility, whether they lived in public housing, owned housing, rental housing, that the quality of housing was absolutely far and above the most consistent predictor of healthy child development. And that living in high quality housing was associated with better emotional well-being, better behavioral well-being, so children being able to regulate their emotions, regulate their behaviors, get along with their peers. Also for older children and adolescents, we found that living in higher quality housing was associated with better functioning in school. So better success, better academic skills, higher growth in skills over time. We also looked at very young children, infants and toddlers, and found that poor quality housing was associated with developmental delays. So looking at specific areas of delays in communication, in gross and fine motor skills, the kinds of delays that put children into early intervention programs that cost communities and society quite a lot of money, right? Starting very young. So we know that children who show these sorts of delays early in childhood are at much higher risk of needing special education services, are at much higher risk of needing mental health services, and of failing to complete high school and gain additional adequate academic skills to be economically successful. So for very young children, we found that poor quality housing was associated with developmental delays and with poor general physical health. So one of the things we were really interested in trying to understand in this work is what are the processes through which this occurs, right? So one hypothesis is that poor quality housing is directly detrimental for children. So exposure to toxins, exposure to pests, lacking heat and hot water are stressful physiologically and they're stressful neurologically, and that can have a direct impact on how children function. So there's a growing amount of evidence about neurological, physiological brain development, particularly in young children, and how that really trickles down through all areas of functioning. So that's one hypothesis, and in fact we found some evidence for that. But the other hypothesis is that the housing environment affects obviously not only children, but it affects the whole family system. And parents are generally seen as essential resources for children. And in certain circumstances, and for certain parents, parents can do an incredible job in shielding their children from environmental insults, right? So parents often take it upon themselves to sort of take up a lot of the environmental stress and shield their children. And we found that that's centrally important. But in really poor quality housing among economically disadvantaged families, parents often aren't able to do that adequately. And when they live in poor quality housing with all of these issues, parents also show poor levels of health and functioning. So we look particularly at poor mothers, and they were much more likely to have high levels of psychological distress, mental health problems, parenting stress, and thus be less able to shield their children, provide healthy, sensitive, responsive parenting to their children. And in turn, this sort of translated into poor children's development. We also looked at a number of other factors of children's broader environment. So one thing we know from this research and from many other people's research is that poor quality housing is often located in poor quality neighborhoods, right? So neighborhoods that have high rates of concentrated poverty, that have low rates of employment, that have low rates of adults with higher levels of education, that have low rates of social trust. And these things often co-occur. We've also found that they often act synergistically, that the combination of disordered housing and disordered neighborhoods is particularly detrimental to healthy development among children. Another thing we looked at was this issue of housing costs. So there's a lot of attention right now and a lot of policy attention, particularly to affordable housing. And when people think of affordable housing, I think people have very different definitions of that, but obviously the title, the name, affordable housing, points to the cost of housing. And the argument is that housing needs to be affordable so that families have enough money left over to purchase other basic necessities, food and clothing and healthcare and extras, to support healthy child development and family functioning. Indeed, though, when we look at the research base, we find that there's actually very little direct evidence that housing costs, what families pay for housing in relation to their income, is associated with children's development. The research on this, the empirical evidence on this is actually quite slim. What we found in our work is that housing costs are associated with children's development primarily indirectly. That paying more for housing for low-income families allows families to buy better quality housing in better quality neighborhoods, and that in turn helps to support healthier child development. But of course there's also a cost to that, because paying a large amount of your income on housing leaves less money left over for other things, right? Which clearly is where policy levers come into play. Another thing we looked at was the issue of residential instability. So moving from house to house. For children, moving from home to home often means moving from school to school. It means changing your schools, changing your peer groups, changing your after-school activities. And we found that high levels of residential instability was negatively associated with a broad array of functioning for children. It inhibited their positive social skills, their ability to get along with peers well, to sustain healthy relationships with their peers. It inhibited their emotional well-being, their behavioral well-being, and their success in school. And we found that this was really particularly important for school-age children, so for children in primary schools. And again, I think it's important to think about this with consideration of policy levers, because when we use housing policy and affordable housing policy, what we're often trying to do is move families, move poor families into higher quality housing or higher quality neighborhoods. But that means moving them, and that means shifting their peer groups, their school communities, which in turn can be detrimental for healthy children's development. So we really have to think about how we can balance these needs that children have for safe and stable environments with a low level of mobility and a high level of stability in various facets of their life. And finally, what our research has shown is that this sort of disorder and chaos often, again, sort of goes together and acts synergistically. So families that live in poor quality housing and in poor quality neighborhoods often have high levels of employment instability, high levels of marital instability. So many facets of their life are showing instability and chaos. And those act synergistically to interrupt healthy child development. So I think when we're thinking about policy levers, we have to think about not just attacking sort of one specific piece of the system, but taking this broader systemic view for children. So I think I would like to end on this lesson of encouraging us to think about affordable housing as a much broader conceptualization of housing, right? So it doesn't just mean affordable in terms of cost, right? The old 30% of your income. It means living in housing that's safe and that's well maintained, not just when you move in, but over years and years. So often when we're developing new housing, we're developing nice housing. It's clean, it's well developed, increasingly it's environmentally stronger, but we need to think about systems that help poor and low-income families maintain that level of safety and stability in their home, right? With things like housing subsidies and heating subsidies and helping them meet their basic needs. We need to think about locating affordable housing in neighborhoods with high levels of safety, with high levels of resources for children, with social capital, right? So we know from things like Moving to Opportunities that moving poor families into lower poverty neighborhoods, there's often a disconnect with social capital, with social relationships, with getting families integrated into the social network of the community. And I think we also have to think about green spaces. So when we look at the slides from the next presentation with new housing developments, one thing that's often missing is attention to green spaces. There's some very good research coming out about the importance of access to nature. And by access to nature, I don't mean having great, beautiful parks and playgrounds. I mean having a single tree outside your house, having a little bit of green space. There's great research looking at hospitals, that patients in hospitals that have a view of a tree or a view of a pond recover physically much more quickly and are much more likely to recover and leave the hospital than patients who have a view of a parking lot, right? So we need to think about green space. And finally, we need to think about these broader systems that help to support family stability in a broader sense. Economic stability, job stability, marital stability, and their ability to sustain all of those systems concurrently to help support their children's development.
Great, thank you.
I will turn it over.
So I also want to add my thanks. Those are two great presentations, and they really touch on where we need to go with community development. It's been interesting to watch, particularly the green building movement as it took off and really focused on energy conservation, and what a limited piece of the whole pie, important but limited piece of the whole pie it is, and you've both really elucidated more. I'm going to show a project and then actually talk further about what I view is the bringing together of environmental ecology and cognitive ecology, and how we need to think of those as one combined realm when we think about creating healthy housing. This is a project called Paseo Verde. It's in Philadelphia, North Philadelphia. Our firm developed it in conjunction with APM, which is a local Hispanic community development organization that's been long rooted in the project. They're 50-50 partners, and they have a very deep hand in the creation of this project. It is the so it's a whole block. It's a long horizontal project. You can see behind. I think there's a. See, there's a, yeah. So. It's literally touching the North Philly train station, which is the second busiest train station in Philadelphia. And then to the upper part of the photograph, there's actually a public housing project, and then beyond that is Temple University. So it's in an area that has a lot of potential resources and a lot of great connectivity. As noted in the study, it actually is a park nearby, but the park is not perceived as safe enough, so people don't generally use it. You'll see in the foreground, in the very lower left corner, there's some new single-family houses, and APM did a lot of single-family development in this neighborhood to bring back home ownership, and they actually created, just a block away further from this, a wonderful retail center with fresh, healthy food and a credit union for banking, savings, etc. The project The right-hand side of the project in the photo is affordable rental. So the right 3 bars, and there's actually right 2 bars and some townhouses, the far right. And the left is market rate rental, or 80-20 market rate rental. And in the base of that is a federally qualified health center. And also APM itself rents about 30,000 square feet, or 20,000 square feet of space for family-based social services. So the project also has an interior health club, and it has a pharmacy. So it's got a lot of health resources located on premises. It was the first LEED Platinum, it's not only LEED Platinum project from an environmental point of view, plus Enterprise Green Communities, but it is also the first LEED Platinum, LEED ND project in the United States. It's, by the way, we think very physically attractive, but it's built out of hardy plank. It's built out of very affordable materials because, as we know in the affordable housing world, we can't really spend much more to make our projects green. And then in between each of these bars, there is a terrace with a green roof. Philadelphia also has a aggressive stormwater program to try and get people to what they call blue roofs, to store water on the roofs of their buildings and then very slowly percolate it into the system. And this is one of the first blue roof projects in the city. These are the townhouses, again, low-income housing tax credit rental, duplex over duplex units. And the interior, one of the things we really focus on is not only healthy and green materials, but large windows so we can really bring as much daylight and fresh air into the units as possible. And I think that's it, because I was only allowed 5 slides. All right, now, so that's just to give you an overview of the project that is described. But I want to talk more about the issue of cognitive health. So this project has all the attributes. We talk about walkability, we talk about on-site health service, we talk about all those things. But the residents bring to these projects, and one of the underlying cognitive dysfunctions we're seeing in the low-income communities that's expressed through depression, all the symptoms we've seen, is something called an adverse childhood experience. And an adverse childhood experience is when a child from 0 to 3 experiences abuse, neglect, household dysfunction, sexual abuse, emotional abuse, physical abuse, excessive noise at home, sudden eviction, observing a mother being subjected to violence, property victimization, peer victimization, community violence, parents always arguing, parental separation, a parent sent to prison. These events in a young child engage what we commonly call the flight reaction. And their HPA axis gets turned on, and in normal human beings, after we have such a traumatic event, we calm down and the excess cortisol and adrenaline, et cetera, in our body goes away. But if a child has 4 more and they're really intense in their formative years, the HPA axis, the neurological system that responds to these stresses gets wired to be permanently on. And what that means in essence is that until puberty, they're in the flight mode. We see AHDC, we see recessive behavior, we see withdrawal. I attended a class of an amazing inner city charter school in Oakland of all these fantastic young kids, and they're all singing a song about the sun, and they go, and the sun rises, and there's like some kids sitting like this. And you can tell those are the kids who've been abused, or those are the kids, who have the inability to connect and to emote and to relate. They're in that recessive mode, and then after they hit puberty, they turn into the fight mode, and so they have very, very high-risk behaviors, and they join gangs, etc. So one of the outcomes that we've studied, that the studies show this, is that a child who has 4 or more ACEs, adverse childhood experiences, before they're 3 is twice as likely to smoke, 12 times as likely to attempt suicide. So that shows depression. 7 times as likely to be an alcoholic. 10 times as likely to inject street drugs. 4 times more likely to have intercourse by the age of 15. 40% of the girls with 4 ACEs or more become pregnant but when they're teenagers. They're 260 times more likely to have COPD, 240 times more likely to have hepatitis, 2.5 times more likely to have sexually transmitted diseases. They're more likely to have lung cancer. They live shorter lives, etc. And so, and interestingly, this has an epigenetic function, which means it actually alters gene expression and passes on to the next generation. Kaiser Permanente did a study that is one of 17,000 people in Southern California, and they looked at this population. The population was 75% white and 75% had a college degree, and yet 12.6% of it had 4 or more ACEs. And so what we're seeing is all the factors that we heard about previously, and even more previously in the school presentation, this enormous neighborhood dysfunction, is setting the seeds of an incredibly unhealthy cognitive ecology. Now, when you add that to the seeds of an unhealthy environmental ecology, so lead and rats, and we know, for example, that children who grow up in, mothers who are pregnant during very high, when there's a lot of pesticides needed in houses to keep down rodents, etc., give birth to lower birth weight and lower intelligence children. We don't fully, there's not been enough study, and I think the next area to study is what is the interdependence between the negative cognitive ecology and the negative health ecologies. But what we do know is that the cognitive ecologies reduce people's ability to their immune system responses. We also know that the health ecological issues reduce their immune system responses, and the combined effect has to be incredibly difficult on the resilience of the residents and their ability to recover. So we've been talking a lot as a housing culture about the resilience of our buildings to recover from episodic stresses. So climate change brings us episodic stresses. I think we need to pay more attention to the endemic stresses, these which are ever persistent in these communities. One of the things that's also very clear is the first thing that for recovery and for curing of these issues is what's called a stable base. It's originally a psychological phrase, but it really deeply ties to housing. And housing as a stable base where a family can live there securely through a child's entire childhood, or a teenager's entire childhood, is the base upon which then you can bring in services and you can begin to create the sense of safety. And interestingly, all the other strategies that one then builds that are part of the solution matrix all require trust, they all require confidence, they all require stability, and they require the parent system also to be calmed down. And so being able to afford housing and know that your kid's safe and know there's after school programs for them if you're working 2 jobs, all those things are critical to solving the cognitive ecology issue that is undermining the mental health and the future prospects of our residents. So what you saw in the project Paseo Verde is you saw because it's a low-income housing tax credit project for half of it, and because it has social services and health services and all the things that are there, it provides the stable basis, the thing that we begin to build upon. But society deeply has to commit to all the other elements. I want to just, one more thing. We only build 100,000 units of affordable housing in the United States a year, and I don't know what the preservation numbers, but Michael Badakin can tell us they're certainly not enough. So I believe we need to build 1 million units of affordable housing a year to really begin to get up to speed to address our problems. And then, but the affordable housing is not enough. We also need a school system, a public health care system, a mental health care system. We need to layer all those things in so that the residents of those 1 million residents, every single one of them is living in a community of opportunity. Thank you.
Thank you, Jonathan. And I think that sort of opens up a really good sort of topic for us to dig into. And I'd like to just sort of pose my first question. And I also want to get folks to begin to think about questions to pose in a few minutes. But I do want to, I have some moderated questions. And just because of the level of expertise on the panel today, just want to take this opportunity to pose some really interesting questions. So I think building off of, Jonathan, what you just shared with regards to sort of the components of cognitive ecology and how it then sort of sets a ripple effect based on these, adverse childhood episodes, and thinking that through, as you started to mention, I think, California's comprehensive plan, and I think your slide beautifully illustrated all these key components that really focused on the built environment, but we did see one particular area around social cohesion as well as access to services. So could you expand upon sort of those two areas and how they could begin to, I think, address some of the challenges that Jonathan raised, which I think are very, very apt to raise as we start to think about a holistic approach to health. So.
Yeah, definitely. I think it's a tough question, right, to address, and I think that's come up, that we have limited resources. How do you start to address all of these issues? From the comprehensive plan standpoint, I think one of the keys is that this happens, like planning is happening really at the local level. So we can provide a context, we can provide a framework. There are certain things by statute that are required for all local jurisdictions to address, such as land use or circulation, how things move through. But I think starting to think about how you also incorporate issues of social cohesion and so in connectivity. So one of the big things that I think is through outreach and through really involving community members in the process. What we've seen is that engagement piece. I think we were talking about it a little bit earlier today, but from the neighborhoods that are high ownership neighborhoods, there's a lot more engagement. In other neighborhoods where there's more renters, it can be harder to engage with people. But I think that there are policies to be put in place, such as plaza spaces. A perfect example with schools that we've seen can be really effective is having policies in place to foster joint use agreement, so that the school is not just there and closed at night, but that it's actually open so that it can be a place for community to collect and to have learning opportunities or social services that come in the evenings. So I think some of those policies can be great. And I think one of the things is that happens, it changes by area. So you can't just say, just do this policy and then everyone's going to do the same thing. Right. Because communities are so different, there are different policies. And that was actually one of the big things we heard as we were doing the outreach was, for the framework to be established, people really said, we need flexibility, because if we're going to be doing this, it's going to change so much based on the local community. So I think that would be really one of the big lessons.
That's great. And I think I just want to bring Rebecca into the conversation. I think given sort of Jonathan's sort of tail end talk with regards to cognitive ecology and thinking about it from a research perspective, what are your immediate reactions to the opportunities with regards to building a better research agenda around some of the elements that were raised over the next few years, mm-hmm. and where are the potential opportunities and gaps in trying to pull together an evidence base? I think we talked about that at the top of this session, thinking about what are the right data aggregation strategies.
I think there are a number of challenges and I think some great opportunities. I think large-scale experimental studies like MTO are extremely expensive and not so difficult to run. I think it would be great to have more of those, but I think we really need to look for more localized and quasi-experimental opportunities. So there's a lot of new development happening. There are a lot of new policies being put into place, and really trying to match up researchers with the policymakers and developers that are leading those efforts, and make sure that we're gathering data and really addressing the efficacy of these new initiatives. That's one opportunity. I think another is to think about the information we have available that's in sort of separate buckets, and looking at ways to match up information. So certainly a lot of research matches up sort of survey data or interview data with census data, but really trying to expand upon those matching things. So being able to match school records to housing information from HUD, being able to match those to census data so we can look at the poverty concentration of the neighborhood, being able to match those to national data on pollution, air quality, and water quality, with crime data. So we have vast amounts of information like that, but they're typically kept by separate agencies, all of whom have different systems to access the data, and all of which are often very challenging. So thinking about how we can better use all the information we have and put it together to create comprehensive pictures. Almost all of those data sources do not have information on outcomes, right, on children's health and well-being and family well-being. So those are data that we often have to collect ourselves, but being able to match those data up with this vast array of national and local data that we already have available.
Right. And I think, Jonathan,
Can I just add something about the social cohesion thing? Yeah. So there's a researcher, Robert Sampson, who had been at University of Chicago, now at Harvard, and he looked at compared neighborhoods of Chicago. Has a great book on the neighborhoods of Chicago. And one of the things he said there are really two things about building social cohesion. And the first is it's highly correlated with neighborhood disorder. And the second thing, it's highly correlated with something called collective efficacy. How well you and your neighbors feel you can make a difference in your community. And what's interesting is that is very local, as Elizabeth said, and it's not hard. You know, things like community gardens create a sense of collective efficacy. Having people just, you know, neighborhood watches, police crime neighborhood watches have a sense of collective efficacy. There are times in which, you know, a bunch of neighbors have just said we're getting rid of drug dealers because we're going to just sit there with like cameras and like film them till like we scare them out of a corner or whatever. These are things that can be done, and they build this enormous sense that our community can make a difference, and that turns out to have a real turnaround. The only other thing is an interesting study that was done in London, which is that every community has like the in people and the out people. And when you change a community's culture to invite the outsider in, you know, the person's always sitting on the edge, the person doesn't really have friends, the person's a little odd, and to incorporate them, it turns out that makes a big difference too. In essence, as a community moves towards a sense of collective altruism, altruism itself seems to be a healing factor.
And I was going to say, I don't know if it's possible to pull up Jonathan's slides, there was actually a photo, and I wrote it down because let's see if we can get them up. Well, why they come up. Yep. It was basically a photo of the development, and it showed the stairwell, and it was out facing to the community. And I think that's one of those things. I mean, there's a lot of work that's been done on crime prevention through environmental design to really help foster that ability for people to connect and to see the streets and to look at the neighbors and to the easy part of just saying hi. And you start to know the people who are around you. And I think that is something that's come out as a really important piece. So, it's up on the screen.
So by the way, one more thing that we did is we also put music in the stairwells.
You did what?
We have music play in the stairwells to try and encourage people to use them for more exercise.
Nice, nice. I think it's a couple, if you could advance a couple just to, it really stood out when I saw it. I wrote it down because it was just, one of the things someone I've been working with is doing a white paper, but it's really changed even in how buildings are designed, that's not part of the general design anymore. It's really isolated, so that's the shot.
Right. By the way, another thing we do is we have, in the hallways, we have bookshelves and little reading corners to try and distribute this idea of libraries and reading throughout the whole building. It's lots of good things in it.
And I think that's a nice segue to really think about sort of the housing development in terms of the specific design strategies in terms of the enhancements beyond just ensuring that toxins do not sort of penetrate the indoor environments, but what are the specific, and I think you touched upon some of them, one being active design, which I think is a big sort of movement that's sort of emerging right now. Many folks in the audience are familiar with active design. Raise a hand if everyone. Great. And I think it's interesting because it's looking at how the built environment can enable better choices. And I wanted to sort of pose this question to the panel as we start to think about, in our role as housing developers and advocates, what are the specific strategies that we need to really be thinking about, active design being one of them, but also the sort of connections, and I wanted to sort of pose to Jonathan to expand upon the inclusion of a healthcare facility, of a healthcare center rather, in the housing development, and sort of what was the genesis of that decision making, and how involved was the community in pushing for that to happen? Because I do see sort of the opportunity to for housing to anchor all of these supports. So I'll toss it to you, and then have the other panelists jump in.
So I say that form follows finance in real estate, and interestingly, in most places, the low-income housing tax credit is limited to $1 million a year of credit. Anyway, the bottom line is it means you can only build 50 or 60 units of low-income housing tax credit in a project, and yet that's often too small for an urban environment to really anchor a neighborhood or transform it. So we had to use the new market tax credit to finance the rest of the housing. That actually brought in mixed income, which is actually a good thing. But new market tax credit can only be used in projects that have at least 20% of the project be commercial. This is also right next to train stations, so all these factors, so the finance, the form, the location, all said we need a commercial element. And then we really asked what are key elements. Interestingly, about health clinics is that health clinics can afford to pay a high rent because they have the economics that allow them to pay a market rent. It's non-subsidized, and in every project we've done a health clinic, we can always rent a pharmacy next to the health clinic. And so it actually, interestingly, is a fantastic confluence of the health and social need model and the financial model, both at the same time.
Great. Do you want to?
Yeah, I would say one of the, again, really thinking about, one of the things is, as we are working in limited resources, I think that looking for opportunities for win-win. One of the previous panelists was mentioning, if I'm going to spend $1, I want to also show that I've had a positive outcome in these other areas, and I think that's really key and important. When it's not something that I'm working on, but I've helped out with it. One of our sister agencies, the Strategic Growth Council in California, has recently gotten funding that's coming from the cap and trade, so it's from the Greenhouse Gas Reduction Fund, and it's actually, there's a new funding program for affordable housing, sustainable community fund that's going to be essentially looking at that, recognizing that by placing affordable housing near areas of transit, that can be very positive. And so it's really a win-win because you can have more active transportation and you can also build affordable housing near transit and amenities. So I think looking at programs and thinking through things of different win-win-wins opportunities, especially in, as we were talking about yesterday on energy efficiency and health outcomes, I think really trying to maximize benefits is one of the key potential opportunities to do that.
I think I would add to that educational services. Right. Schools and early educational services.
I think that's key. No, I think that's absolutely right. And I actually want to turn it over to the audience. We actually have a question from the Twitter sphere right now. I'm going to pose it. I think Jonathan, you'll be the best position to answer this question. So, how do healthy building materials and on-site health clinics affect development costs or sources of funding? I think you touched upon that in your last comment.
So the on-site health clinics actually help the funding, and healthy building materials cost essentially nothing more. They just cost paying attention and knowing what you're doing. I'll give you my favorite example. In a lot of our buildings is whenever we can, we use spray-in cellulose insulation. It is recycled material, but it's soundproofs. It's actually a better insulator, but also, what's really interesting, it's healthier for the workers to install, but it is fireproof with borax, and borax is a natural insecticide, and so it automatically makes cockroach-free environments, just from your insulation. So it's part of an integrated pest management strategy too, all for no additional cost.
That's fantastic. So I see we have someone waiting. Could you introduce yourself as well before?
Hi, I'm Rick Rybeck with Just Economics. I want to thank the panel and everybody who's been here this morning. Great conversation about thinking about things holistically, how transportation, schools, housing all work together for health. And I was interested also in the discussion about the problems of limited resources and looking for win-wins. And one of the things that occurs to me is that if we have a community that's not doing so well, and we help to uplift the schools, land values go up, and some of the people we want to benefit from that better school all of a sudden get priced out of the neighborhood. Mm-hmm. If we decide that better transit would really help people in this neighborhood, and we improve transit in the neighborhood, we put in a light rail or a metro rail station, land values will go up, and some of the people we intended to benefit from this end up being priced out. And one of the things that some communities have tried, I don't know if anybody on the panel is familiar with this, is they've tried to remedy this situation by reducing, basically transforming their property tax into what I call a public service access fee. What it means is that they shift the tax off of building values and onto publicly created land values. So the net result is that the jurisdiction collects the same amount of property tax they did after the change as they did before, so it doesn't cost them anything. But by reducing the property tax rate on buildings, and Mr. Rose, you know this probably better than others, by reducing the property tax on buildings, the buildings become cheaper to build, improve, and maintain over time. Most property taxes are around 1 or 2% of value, which doesn't sound like a lot, but unlike a sales tax that's paid once, the property tax you'll pay every year that the improvement adds value to the property. Over time, it's like a 10 to 20% sales tax on construction, labor, and materials, which is a pretty hefty cost barrier for affordable housing. So by reducing the tax rate on housing, you make housing more affordable. Surprisingly, increasing the tax rate on land values makes land cheaper because, and this is a little counterintuitive, but unlike buildings, land isn't produced. And what people bid for land is based on the benefits they expect to receive from owning it. So if you increase the tax on land, that's a cost of ownership, not a cost of production. Makes the benefits of owning land go down, and it actually reduces the speculative demand for land and helps reduce land price inflation. Plus, it means that the values that we create publicly through better schools, better transit, come back to the public. And then the public can use that to make sure that the benefits we're providing go to the people we want to give it to. I know Harrisburg used it to revitalize its downtown after Hurricane Agnes devastated their downtown in the 1970s. I was just wondering if anybody on the panel is familiar with this or if they have any thoughts.
It's a great question.
I don't know enough about tax policy to be able to answer this. I'll leave it at that.
Okay.
Well,
I just wanted to...
I'll just say, I don't know much about tax policy either. That's the benefit of working cross-sectorally. Whenever these really tough financing questions come up, I look to my colleagues that handle that and have the deep expertise in that. I would say there are a couple of interesting other things about trying to make the building cost less. And so taking parking out, for instance, and decoupling parking has been one strategy that I think can be effective to help allow the affordable housing to be on site and developed. But again, I would defer to
So Enterprise, though, has been doing extraordinary work with several communities, such as Denver, et cetera, to fund community-based land trusts to be able to buy land next to mass transit in areas that we know are going to be rapidly improving because of zoning, because of new. Denver, for example, is a whole new transit system going in. Mm-hmm. And so community ownership of land is really, really helpful. Another thing we need to pay attention to is it's not just, gentrification is not just a housing issue, it is a small business issue. And what we do lack are small business ownership programs, because if a small business can own its store, its building, then as the neighborhood improves, instead of being priced out, they are building equity.
And I think that's right, and I would actually, mention that building on some of that work, there's also, activities around really looking at the opportunities to reduce the cost of affordable housing development, and Enterprise has been involved in that along with other national entities to really think about those types of sort of really innovative solutions. So want to make sure that folks are aware of those conversations as well. And I see a person waiting in line, and we also have a Twitter question, but but for the person in person, I think it's best to have you pose your question.
Hi, my name is Cindy Smith, and I'm from Dorchester County, Maryland. We're a small rural community on the Eastern Shore. I have been tasked to deal with a county issue, which is a lot of foreclosures due to tax liens. And we'd like to parlay that into affordable housing. But one of the questions I get from our elected officials is the balance between affordable housing in a community and higher priced housing, and is there a good mix, or is there a number you should go to, 10%, 30%, 50% affordable housing? So that's kind of, you know, I get pushback from the elected officials in the sense that affordable housing wouldn't necessarily bring in the right people, but we need more affordable housing. We need to do something with these foreclosed properties. We want to work with Habitat and our housing authority, and, you know, so anyway, it's more just a number that I'm looking for. Or is there a number?
Oh, okay.
Well, does somebody else want to answer that? So the first thing is you got to get rid of the thought that affordable housing is going to bring in the wrong people.
Yeah, I was going to mention the perception issue is a big one.
And number one, begin with who's there. Who's actually in your community who is underhoused or needs housing. You're going to discover that if you do an internal housing needs study, that there's enormous needs. And by the way, interestingly, other people don't really want to move to your community. I don't even know your community, but what I've discovered is other people don't want to move to anybody else's community. They want to stay in their own community. They want to have a great community in their own community. There's much less moving than you'd think. So then the second thing is there's no one affordable housing need. There are young people getting out of college who can't afford to live somewhere. There are aging seniors. There's homeless people with AIDS. There's this enormous diversity of affordable housing needs. There's you know, hardworking families who are working 2 minimum wage jobs. There are, in many communities, we're seeing that school teachers, by the way, home health aides earn under the poverty limit. They earn $20,000 a year average, and they can't afford to live in communities. So it's really to look at the diversity of populations. It's not one, and what you want as a balanced community. What do you feel, you know, so for, you know, take, for example, the school system, the custodians who work there, the school superintendent who works, look at the whole range of it, and grow the answer out of what it takes to be the right and healthy, your current community and its healthiest form. And that'll tell you what your percentages need to be and what kinds of different housing needs you have.
I would just add to that I think when we think about poverty and we think about concentrated poverty, we think of big urban areas, right? We think of Chicago, we think of big urban areas. Poverty has always been extremely high in rural areas, and it's actually become more concentrated in rural areas. But I think what's perhaps one of the most shocking statistics recently is that there are now more poor people living in suburbs in America than in urban or rural areas. Suburbs hold the greatest number of poor people in America. And I think that's a geographic location where we very rarely think about affordable housing and housing subsidy programs.
So important. So I'm going to take this question from Twitter and then open it up to you. So what are the best methods for evaluating return on investment in affordable housing when outcomes relate to both health and education? Do you have any?
You want to, as a researcher, I have some ideas. But
I don't think that there's a simple answer to this question. I think we need more work in this, but I think that this is something that's essential to pay more attention to. So we talk about the cost of building new housing or building more affordable housing, or the opportunity cost of what we're losing in market rate housing. And I think we need to really take a broad look at what are the repercussions. Right? So you can cost out what it costs to care for a child with asthma. You can cost out what it provides to provide early intervention services to children with developmental delays. You can cost out what special education services cost for schools. You can cost out what every child who drops out of high school costs to the national economy. So you can create models that cost out all of those things. Even if you have a 3% increase in developmental delays or special education services or jail, from high levels of problem behavior. That's a huge cost to communities and society that we don't take into account when we think about what's it going to cost to create this new housing development or create 20 new units of subsidized or affordable housing.
So studies show that if you take each year, each age cohort year of kids affected with 4 or more ACEs, the lifetime cost to society is between about $100 and $400 billion. And that's each year, so if you got 20 years at it, it's in the trillions of dollars. Affordable housing is subsidized by the public. It's not built, it has private sector money in it, but it can't happen without the public sector funding. So I think what you need to do is actually look at from the public point of view, that's the framework, and then you can look at return on investment in all these investments and what they do to eliminate future cost.
I would say the last piece to add is the data sets, using data from different agencies. So one of the things is a lot of the studies, the research will look at one piece of, it's just asthma, but it's not looking at the comprehensive picture of health. And so I think really starting to think about some of those other data sets in addition to well-being. So as we define health not just as disease or the absence of disease, but total well-being, starting to track some of those indicators that then can also link to return on investment will be key.
That's great.
Hi, I'm Val Iverson. I'm with the Arizona Housing Alliance. And we have a room full of people here from the community development side talking about how we can affect our built environment so that we have healthy communities and the healthy residents within them. So we have pretty much the built environment side being that water's being carried by community developers and planners. But there's a flip side to this coin. There's that whole health sector side. The healthcare industry, the insurance industry. And we heard from the previous panel talking about those connections that they're trying to make with the education system. So it seems like there's opportunities, especially with the Affordable Care Act and things that the hospitals have to do now for community benefits, similar to what the banks did when they had the CRA requirements, that there are these opportunities to connect with the healthcare industry so that they can see influencing the built environment as a big prevention measure. So I was just wondering if you have any recommendations or strategies on how we can start to make those connections with the healthcare industry and build those partnerships.
Yeah, definitely. I think it's a huge opportunity and one that I didn't get into as much, but so in California, the community health needs assessments were already happening with nonprofit hospitals. I think a huge opportunity with the Affordable Care Act is now there's actually an implementation plan. So community hospitals, and I've been doing a lot of work with Kaiser and many other hospitals, meeting with some of the CEOs, are starting to think about this as an opportunity. I think that's one of the things. They come to the table and they're like, we don't know how to get the crosswalk put into place. And so I think, in your local area, just starting to reach out to the community benefits program to start having those conversations is a key first step. But I think that is, it's really moving and a lot of people are thinking through this. So I think the other thing is local examples that really are positive and impactful. So for instance, Kaiser, again, is one of the agencies that I've been working with, and they have really started to think about bringing people together around transportation and access to healthcare and access to food services and funding some of those, what we call upstream interventions to help do that. It's a great point.
Great. And I'm sorry, we have just a couple of minutes left, and I do want to sort of pause at this point for closing comments, but do encourage those that are waiting to come over afterwards. But at this point, I think, given, especially since we're gearing into lunch at this point, but I do think that as we sort of wind down this particular conversation and really look to the future, I think there's a willingness to think about what are the right partnerships that need to take place that really cut across sectors. And I think, each of you touched upon the value of those types of sort of partnerships, but would love for you all to just sort of take a few seconds, because I know we're running low on time, to talk a little bit about what is the right sort of partnership profile? So as folks sort of go out into their communities to think about a partnership with a local hospital, let's say, or thinking through what are the local solutions that make the most sense, what are the right partnership profiles that they should look to another organization to have available to ensure that it's a fruitful partnership?
I'll go first. So I think one of the things that's been really great is that this role is included reaching out to people across the state, both in private sector and in the state government and local agencies. I think some of the keys that have been the most important for partnership is just listening first, to figure out where people are at and what they're interested in and why they're coming to the table to meet. We have some examples. So we have a health and all policies task force that meets at the state level, where all of the different agencies come together to think about how their programs have an impact. So for instance, we just put together a statewide active transportation plan, which is great. But it's also with partnership. So U.S. Green Building Council in Northern California has been working on a building health initiative, and that's bringing people together from very diverse backgrounds. So it takes a while to actually understand what the person's coming in for, and I think listening is the first step.
Yeah.
I would add to that, I think researchers are essentially important to try to answer some of these questions, but I think also other community organizations. I think the school example was a fantastic example. And in many communities, there's a lot of mobility in urban areas with school choice, but in smaller communities, in suburban and rural communities, the schools are often central anchors for the community and for families. And they often know much more about the needs of the community than people realize.
I agree with all of that.
Fantastic.
And
yeah, exactly, as we have the large numbers counting down right before us. I thank you all for listening in on our panel, and look forward to any future conversations after, as we lead into lunch. So thank you all.
Thank you.